tonight about the Māori Health Authority. Before I begin, I would like to know if you don't want to have your video shown or your name, please change your name and turn your video off. But welcome everybody, let's get started. I'll begin with a karakia. He whakataka te hau ki te uru, whakataka te hau ki te tonga, kia makina kina ki uta, kia mataratara ki tai. Ehi ake ana te ata kura he teo. He huka, he hauhunga, haumai e, hui e, tai ki e. My name is Dr. Hu, Dr. Huhana Hickey, Dr. Hu for short. I am a lawyer, a human rights lawyer, and I work within the health system around the identity of Indigenous disabled people. So I have an invested interest in seeing how this Māori Health Authority is going to work. And I'm quite keen to hear from our experts really in this area because they're the frontline workers who deal with our clients every day. Now, first of all, we have Dr. Emily Gill coming up. So I would like to introduce her briefly. I have. Let us now begin with Dr. Gill and take it from there. And she can fill you in on what she does, her role, and how she sees how the MHA can work within her area that she's working in. Thank you, Dr. Gill. Go ahead.
Kia ora koutou, ngā mihi nui Huhana. So my accent's American. I'm of American settler ancestry, but was born here in New Zealand and trained here as a doctor. So I'm a GP, no Opotiki Ahau, Eastern Bay of Plenty is where I reside with my family in Opotiki. I'm speaking to you as a citizen and a resident here in Opotiki, but who also happens to be a GP. I can share a bit more about why this is such an important topic for me. And it's because I've been living here in the Eastern Bay, working with a predominantly Māori community that's rural, mostly down the coast with Whanaapa, but also here in Opotiki with Whakatoia. And my family and I, we've chosen to reside here and made that a permanent decision a couple of years ago. And it was really solidified when our children started at Te Kura or Maramutu down the road from us. So being here in this community has really highlighted for me the importance of creating a better, fairer health system for everybody. There are many, all you need to do is Google Māori health inequities, and you can read all the information we know very clearly about how our current health system is unfair. What I was going to focus on this evening was more the positives that I see that the Māori Health Authority could provide for us. And that was really clear for me personally during lockdown last year in particular. So within a couple of weeks, the Whanaapa iwi worked really closely with the health centre and created one of the first, I think, in the world community safety zones. And my role as a GP was being involved in our telehealth system. And so I was ringing patients. And what really stood out was how safe people felt in their bubbles really early on when we were still even figuring out what bubbles were. And what patients would say to me is, every day I have a community contact person who is responsible for delivering the food at our gate. They call me every day. I know who to call. And people felt really embraced by that community, Māori and non-Māori alike, in this really strong iwi partnered program along with our healthcare system. And what was particularly noticeable was that other people noticed it. So my colleague and I were contacted by our regional cardiac service, who was also calling people during lockdown to see sort of how are people going. And people in our area stood out for feeling that sense of safety during lockdown. And then fast forward to this year, we have one of the highest rates of vaccinations. We were one of the first rohe or group in the area to have really good vaccination rates. So for me, that's been a really concrete example of how a really strong iwi partnership with the healthcare system can actually lead to a really great system for everybody. So because of the experiences I've had living and working here, when last year the announcements came for what the health reforms the recommendations for our health reforms that came out in June last year, what was really striking was that the recommendations of the majority of our health experts was actually partially rejected by Heather Simpson. And so fortunately, though, what the original recommendations were included in the final report. And so a group of us here in Opotiki, Anamika, Paina, and I, and others, we said, well, we actually need to petition the government and say, hey, put forward the actual recommendations of our health experts, which was a Māori Health Authority with commissioning rights. So that petition was where this started, and I played a role in helping drive that petition. We delivered that earlier this year, and then several months later, the government has announced that, yes, indeed, we will have a Māori Health Authority, and there will be commissioning rights, which was just so exciting and such a great step in the right direction. What we're this evening, though, talking about now is the next steps. So that was the petition part, and now it's the campaign part, because what we need to make sure is that those commissioning rights are robustly protected in legislation so that this new Māori Health Authority can actually have genuine authority to make the differences that I've been able to witness in our area. So where we're up to is, and I also wanted to just say that I am speaking as a citizen. I have no role myself in the health reforms. So the information I'm about to share is based on following news reports, information from colleagues, and a real shout out on tautoko to Action Station for helping me understand where we're up to in this campaign. So what's happening right now is there's a transition unit that the government has put together that is responsible for implementing those announced reforms earlier this year, including the design of the Māori Health Authority. So what the transition unit will do in the next few months is put forward the design proposal to Parliament. And it is very likely that there's going to be legislation required for the Māori Health Authority specifically. Then the legislation, in order to be passed, a select committee process will be created as part of that legislation process. So tonight is about sharing information about what we think, what our collective aspirations are for the Māori Health Authority, and how we can collectively support that vision to be realized. So at the moment, what the Māori Health Authority has not been determined. It is in the process of being determined. So what we as residents of Aotearoa can do right now is you could contact the transition unit directly. So we'll provide some links with emails where you could do that. Another thing you could do is contact your local GP, general practice service, which at the moment, the commissioning for general practice is through something called primary healthcare organizations, PHOs. So your GP practice will be connected to a PHO. You could contact that PHO and find out what are they doing in terms of conversations about the health reforms, and you could ask, how can I participate in that conversation? You could talk to your local MP and share your personal aspirations for what this new design is going to look like. Finally, for those of you who are connected with marae, you can contact your local marae, because a big part of this reform is going to be Māori iwi partnership boards. And so each iwi is actively at the moment designing what that looks like. So you could participate in that conversation by connecting through your marae. So that's sort of where we're up to right now. And then the next step will be once the design has been put through to Parliament and it goes to the legislation process with a select committee, at that point it becomes more political. And when even the first health reforms were announced, we started noticing a public discourse with a little bit of controversy. And so our role can at that point be to help the public discourse be positive and really highlight what all the benefits for all of us about what these reforms could be. And at that point, we might be putting forward a presentation to the select committee. People can contact their local MPs. And so that's sort of where this campaign is aiming towards. So hopefully I've sort of outlined a bit about who I am, why I'm passionate about this, what my role in this this particular campaign has been, where I understand we're up to in this journey, and what the next steps might look like. Kia ora.
Kia ora. Thank you very much, Dr. Gill. And I forgot to say, please, people, put your questions in the Q&A and we will answer them at the end. So I have one already and I'd love to hear any other questions that come through. That was a great introduction. Thank you for that. We now have Dr. Maria Baker, who is going to talk to you as well. And she'll be talking about Māori healthcare practices already happening, Māori framework strategies, and what could be the impacts upon our communities. So, Dr. Baker, this is your time now.
Maria Baker Ho. Kia ora koutou and good evening, everybody. Thank you for joining us for this wonderful opportunity. It's lovely to see the chat and where we're zooming in from and connecting with across the water, and I see also Aotearoa as well.
Sorry, Dr. Baker, I hate to interrupt, but we can barely hear you. Can we get a slightly clearer? That was a bit better just then.
Okay.
That's it. Got you now.
All right. Well, let's start that again.
No, lost you again. I think it's you're fine where you're there. Don't move. Talk and don't move.
Don't move.
That's it. You're nice and clear now.
All right. Well, kia ora koutou. I am zooming in from the very far north, so I think hola to those of you from Te Taitoko and also zooming in from the far north. So kia ora koutou. I come from a Māori health professional background, as many perhaps are interested in that are connected into this evening. And when we think about the number of different Māori models of practice and frameworks, you can't hear me?
Not very well. But can you hear me, Maria? There's some people in the chat that are very helpful and that are saying that you might be logged in remotely and that you need to run Zoom locally. I personally don't know what that means.
Yes.
But maybe you do.
This is it. Fibre and Te Taitoko. So would you like me to touch up and turn my camera off? That might actually help.
Maybe. You can try.
It might. Now, can't hear you at all now.
Headphones, another suggestion.
It might be the headphones because those ones often break.
No, I don't have any headphones. So I think go to the next speaker, Huhana.
Okay, let's see how you go.
Yeah. All right. How's this?
I think just speak very closely to the speaker.
I am. How's that? Carl? No, I think you need to take it to the next speaker.
Okay, we'll come back to you, Maria. Thank you. Dr. Glen, Colquhoun, we've got you coming up now, and we'll come back to Maria. Hopefully we can get some clearer kōrero because it's a very important one, especially for Northland whānau. So Dr. Glen Colquhoun, he wants to tell us how he's connected to the Māori model of healthcare, and I know you work very closely with Māori clients, so I look forward to hearing from you. Please take it away.
Kia ora Huhana and kia ora everybody out there. My name's Glen Colquhoun and I work as a GP in a youth health service with adolescents between the ages of 10 to 24 down in Horowhenua, and many of our clients are Māori and Pasifika, and and prior to that I suppose I've pretty much worked most of my career working with iwi health providers at various stages. And I guess the big thing for me, and I speak as a Pākehā in this debate, I think the thing I want to say most is personal, really, in that I was a young Pākehā medical student when I went to a little place called Te Timanganui up north in Northland, not too far from where Maria is now, and that really revolutionised my practice of medicine, to be honest. Not so much in big political ways that we're talking about here, but in lots of personal ways. Working, getting to know the people there really showed me the power of connecting and building relationships with people, and using spirituality in the consultation, being open to more ways of connecting than just me telling you what to do, and sense of humour. That, I don't know, my experience as Pākehā, most of my patients who are Māori have terrific senses of humour and a huge ability to laugh at themselves and to laugh at me. So using humour, connection, seeing my patients outside, living in community. So I've seen patients outside of the consultation room, so they see me as human, and I see their connections, how they connect to this person and that person. But there's something else too that was magical, and I learned it from a lot of those aunties up north, their ability to pierce you with their eyes, to know what was going on in your head, even when you weren't sure of it. And I often put that down to the fact that a lot of those old people had seen a lot of grief and a lot of pain, and I think still tragically, Māori see too more than their fair share of pain, and it had built a huge personal spirituality and resilience. And I like to think I carry what they taught me about holding somebody's energy in the room, holding it lightly and not avoiding it. And I've spent my whole career, even as a writer, trying to catch what it was they did to me in a look. I could write about it for the rest of my life. So trying to catch that. It isn't the only place I've seen that. I've seen that in other places, but I found it in spades within Māori communities. So me personally, I don't think we have to wait for a Māori health authority as mainstream clinicians or as Pākehā to adopt Māori models of care. And that was that changed how I practice medicine. It still informs it. I also bring a sense of cantankerousness to medicine too, that Māori taught me. Māori, I don't know who speaks for Māori. They speak for themselves and they speak against themselves, and they're always debating. If someone's laughing, someone will make you cry. If someone's crying, someone will make you laugh. So that sense of always testing, always probing, popping bubbles, questioning sacred cows, I think that can be part of the model too. So that's how my experience of working with Māori has changed my practice, and something I've taken into my personal life as well. So I can't help but think that's a positive thing. It's been a positive thing for me. So I'll probably, I'll leave it at that for now, but that's the core of my thinking. Everything comes from those old aunties and the way they look at you. And if you've been looked at like that, you know what I'm talking about.
They're the power of the whānau. They're the rocks behind in the whānau. Thank you for that. We'll come back now to Dr. Maria Baker, who's got some new headphones from the Mokos, I think. So let's hope we can hear her clearly. Take it away, Maria. That sounds good. Yes.
The wonders of lockdown and Noel Leeming being able to do delivery during that period, was able to get Mokopuna some new headphones so he could do some learning and be connected to the digital space. So my total aroha to the whānau for this bit of a disruption. So kia ora koutou. And beautiful kōrero from Emily and Glen, which gives lots of different segues to, I guess, what I've been asked to kōrero about. As I mentioned, or try to mention, I'm from Te Tautukaro, and I'm actually calling in from the very far north. In fact, I trained as a registered nurse a long time ago and focused mainly in adult Māori mental health, and came home back in the late 90s to work with whānau. And actually at the time, the big shift was really about the Māori health professionals that were qualified and coming through clinical pathways was to move out of mainstream services and to go home. So I was fortunate to go home to the far north, and we've been resident here in a beautiful place called Ahipara for those surfers and fishermen and people who love kaimoana since the late 90s. But in fact, I've worked around in a few different places before, but in fact, it was my time with the 5 iwi who coached and supported me in terms of my own practice, and quite honestly continue to drive the work that I do, which has been shifted away from the clinical frontline for a while now, but specifically working with health services and health professionals in workforce development. So at the moment, I work for an organisation called Te Rauora, and we are a prime example of the wonderful work and the journey blazers, the Sir Mason Juries and many others that have really set the pathway for us. And if we think about it, and I guess, as you get a little bit older now, it's been way 40, 50 years of many people, if not more than that, in terms of Māori saying that things need to change. If we think about it in our health space, there's still the conversation about that wonderful earlier model around Te Whare Tapawha, which was reintroduced in 1984 by Sir Mason, or Dr. Mason Jury at the time when he was a practicing psychiatrist. But, really the conversation was that framework was introduced so that it would inform non-Māori of the preferences and the aspirations of Māori to have a holistic wellbeing and approach to health. So if we think about it now, and it is almost 40 years since those earlier times, that there are hundreds of Māori frameworks now in practice across Aotearoa in many areas, many sectors, which draw on the strengths of Māori. Implicit in those are Māori wellbeing concepts. And because they've been pulled together, they're really being driven by the challenges in the westernised world and the service deliveries in terms of some of the current tools and models of practice, which continue to ignore, I think, the spiritual and cultural and social and environmental elements, which are so important for wellbeing for anybody actually, but specifically for an Indigenous people. I think if we think about the differences in what we're seeing across models of care that are led by Māori, that are informed by Māori, is that the differences is that it's designed, implemented and evaluated by our own people. And of course, many of those include our own cultural terms and implicitly also include what's a good life for us as a people. If we think about it, also, we've got our own ways of being, and it was really lovely to hear the kōrero from Glen about the kuia and the kaumātua that give you that look. I still get that look, and I'm a little bit older now and still get called Gill, which is also really nice. But just means that I've got to do as I'm asked, which I do. And it's certainly been in a privileged position to be able to do some things. But some of the work that we've really been able to reveal is the number of Māori frameworks that Māori have been putting into practice in varying ways that favour our strengths, that favour holism, that encourage collaboration, that support and sustain empowered relationships, and also think about the different way that we view data and what's good. If I can think of anything, and particularly at this time, probably the most transformative Māori framework has to be whānau ora. It has to be. If we think about it originally as a cross-sector and agency approach, and we think about whānau ora, on a very simple basis, the kōrero around that was about healthy families, but it's more complex than that. It's a concept, it's a philosophy, it's a practice, it's a framework. And what we've seen as a result of the work over the last decade or so is that the approach from health services that take on the whānau ora approach have been extremely inspirational. The goal has been to maximise health and wellbeing for the whole family. It's about supporting, connecting families. It's about imagining whole of whānau approaches where whānau can complete aspirational planning. They can complete and be part of processes that they lead. that take into account their aspirations, goals, and some of those areas for improvement across the health continuum as a whole whānau. We don't actually have to imagine these are actually in practice now. And we see the massive differences that we see through whānau order commissioning, which is already in New Zealand with 3 whānau order commissioning agencies, one in the North Island, one in the South, and for both Māori and all communities actually, in addition to our Pacifica Futures in the South Island. But if you think about it, the work that is occurring now, we're seeing it through the COVID-19 response. Māori are leading the way. And although it's led by Māori and Tiroranga Tiratanga, it's actually about community. Many of these providers were established to support communities, those communities. I remember in the COVID response in Te Taitukarau, beautiful, many stories about iwi leading, buying water for all communities, making sure kuia kaumātua are fed, supported in some way, varying types of activities, and they're still doing it again in this Delta variant response. So when we think about it, going forward, we need more of this. It means a different way of working, different contracting, different funding. It also means a new workforce, more workforces that can work across whānau and in collectives, in addition to thinking about what health and wellbeing mean for us from a Māori perspective. These are the ways that we've got to work in order to be able to improve social and cultural outcomes and better wellbeing, no question. Kia ora, Huhana.
Kia ora, Maria. That is beautiful. And whānau, please, if you've got a question for any of our panelists, please pop it in the Q&A. We will come up to that very soon. We've just got a couple more kōrero, and then we'll come into a Q&A session. But okay, what I've heard is whānau ora is a very key part, which is open to everybody. And whānau ora has been very transformative. I know that for myself, it's one where you not just dealing with the individual, but you're dealing with the whole whānau, the people that are all a part of your life, but also you're dealing with the environment, the situation, everything else that goes in there, and looking at making it more positive. How does MHA impact me? Well, as someone who is whānau hawa or disabled, I'm in a wheelchair, I have MS, and I struggled a lot with doctors diagnosing, because even though I'm Māori, I'm also Aboriginal, Navajo and Sami. So I have more than one ethnicity here. And they always said to me, you can't have MS, you're Māori. And it kind of didn't make sense to me. We are all of our whakapapa, we are all of our ancestors. And yet when it comes to diagnosis and treatment, we often, we refer to, I'm Māori because I live in Aotearoa. My siblings live in Australia and they identify as Aboriginal more than they do as Māori, and that's natural. You identify where you grow up. But for MHA, it's going to be an interesting journey. I'm really keen to understand what that would mean for me as a disabled person. Do I have a voice there? Because on the DHBs, we didn't. None of the DHBs really represented disabled people on those decision-making boards. The MHA and the HA have a opportunity to bring the Haua voice in and to let us also be part of the solution, not always part of the problem. Part of that is I'm a little concerned because we're hearing that there'll be something coming out apparently this month around how they're going to deal with disabled, but disabled access health. Disability is different. I can be a very healthy disabled person. It means, but when we access our health service, does it respond to our needs as disabled people? So if you're blind, are you able to get information in Braille or in a format that you can put on your computer and hear it back to you? If you're deaf, do you get it in that form of language? If you're intellectually disabled, do you have a voice there? And those things have been absent from our health system for a long time. Will the MHA, will the HA be able to do that for us? I don't know. At the moment, the jury's out until we see how it works, but I continue to be a little cautious, but I am hopeful that we get rid of the political aspects of DHBs and that we bring in a more clinical, knowledgeable, localized understanding when we have people sitting on the boards, because what we do need is we need the voices of the community. It's ironic, I'm here in South Auckland, and you know, there's very few people there that represent me that sit on that board. There's a Pacifica voice. Yes, they have the Māori voice, but if you look at their backgrounds, they're not health backgrounds. I'm an ex-nurse, I have a health background, but for a lot of the people that sit on those boards, they don't. And so how can they advise on something that they don't really have a background on? So it's just important that we try and make sure that all the voices are being heard with these new authorities. I am hopeful that we'll get that, because it's gone away from the political and it's going to the more skilled voices within those new systems. So I'm hopeful for that. And I guess what I'd like to know as well is, you know, some of the argument that's been put out is separatism, that this is a separatism thing. Well, for me personally, I understand why people are concerned. I'm not into separatism at all, but I am into partnerships. And the treaty promised us that we would have a partnership. And in a way, the Māori Health Authority, for me, offers that partnership option. So it means that we have the Māori Health Authority and the Health Authority standing alongside each other in partnership. Why is that important? Well, within Māoridom, 24% of mainstream identify with disabilities. 68% of Māori are disabled by the time they reach the age of 40. That's higher than any other group. We also have the highest on average, 33% of Māori are disabled. And most of the disability with age related comes down to poverty, comes down to lifestyle, comes down to being manual workers where your body is wearing out a lot quicker than others. And so that's a big issue. And we need to make sure that the Māori Health Authority gets this right. So for me, I'm curious around, you know, how do we address some of that inequity that has existed? Can we close that gap? And I'd like to hear next, I guess, from Dr. Emily Gill and Dr. Maria Baker around the importance of commissioning rights and adequate funding. What else do you think is important? And if time would like to touch on the runanga whakapeke Māori, the ultimate MHA in commissioning for wellbeing, because isn't it about being well? And I guess we have to look at health in a different way, hospitals differently. They used to be places of disease and dying. Well, they still are in a way, but do we not want places also of health and wellness? Because if we turn things around differently, will people embrace it differently and be more proactive around their own health and well-being? So I guess I'll leave that. Emily, Maria, whichever wants to go first, please do take it away. Emily, would you like to start? And then Maria can go from there. And Glen, if you've got time or you think there's anything else to add in there, we've got time.
Kia ora. So yeah, just awesome kōrero. So very cool. I might just focus on the question about the importance of the commissioning rights, because there's a lot in this conversation, and it is about the personal experience, as Glen and Huhana have spoken about, and it's trying to figure out how we can make the system support that personal experience, which is the most important thing. So, but commissioning is a part of that. And so one of the things about these collective aspirations is to make sure that the commissioning is well resourced. So the Māori Health Authority is about funding existing gaps. And because we have a bit of time, I'm actually going to feed in a comment that has come through, wondering about how statistics can be seen differently. And one of the real big things about data is thinking about things from a strength-based perspective as opposed to a deficit focus. And what that can mean in real terms is figuring out what gaps are unfair. So for instance, if there was statistics that showed right-handed people had lived longer and had better health outcomes than left-handed people, I think most of us would agree that is unfair. There's nothing inherently different between right-handed and left-handed that should mean you should live longer or not. There are going to always be differences. For instance, only people with prostates are going to get prostate cancer, and only people with uteruses will get uterine cancer. Okay, so there will be always differences between different people, but there are things that should not be different. And when you think about statistics from that perspective, and you see that something that should not be different, like rates of diabetes, like mortality rates, those should not be different between different groups of people. So with statistics, the way information is analyzed needs to be done from a strength-based perspective. And a Māori Health Authority will do that because it will be led by Māori health experts who are experts in looking at data from through that lens. And we know that data is not interpreted in that way. There's loads that you can read about, and if people are interested, we can put references around how data has been interpreted from a deficit perspective to the detriment of people. So back to this question of what we need to do now with the commissioning rights is we need to protect that those commissioning rights are strong, robust, well-resourced, and to focus on where the unfair parts of our healthcare system is. So the current provisions remain the same. The Māori Health Authority will be identifying and bridging the gaps that we've been talking about. So one other last comment would be, the current system we have has been around for 50 or more years, and there's been plenty of mistakes and learning that have happened along the way. So what we know is that experts who have looked at our current system have said, well, what we need is a new one. We need a new health system that's fundamentally different. That's not going to happen overnight, but the only chance for that to be successful is for it to be invested in sufficiently with appropriate resourcing and protected for a period of time so that there's time for this to actually occur. Kia ora.
Oh, thank you there, Dr. Gill. And now Maria, please do take it away.
Kia ora and kia ora koutou. I'm really privileged to, I always say with my role as CEO's Te Reo Ora is to translate the dreams of Sir Mason, which is a big mission. But actually we have access to a gentleman who has inspired many of the transformational changes across the health and social system for many years. The following kōrero is a presentation of just some of the points from Sir Mason when he delivered at Toitu Hauora, which is a Māori Health Leadership Conference that we hold, well, we try to hold each year, but COVID, of course, like anything, has disrupted that. In his kōrero, and I guess if we think about the work that has been underway for numbers of years and thinking about what we need changing, there certainly is a need for a legislation change. We know from the Y2575 and certainly with the Simpson report, which Dr. Gill had mentioned, that there have been some statements about a need to shape the modern health and social system for Aotearoa. I believe we need a Māori wellbeing legislation myself, because actually it needs to go across all the aspects that influence wellbeing in its very broader sense. That legislation also needs to challenge the Crown in its failure in implementing programs that fall short of what we need and addresses the racism that we've had in our system and continue to have within a system. So if we think about excuse me, the conversation from Sir Mason, and actually part of some of the recent work from the Waitangi Tribunal claimants, which has been a really big fight for a number of years. For those that haven't been publicly aware of that, there have been a number of different people that have been fighting and working to try and address the issues within the system. One of those groups is the National Hauora Coalition, who recently commissioned a report on behalf of the claimants who had made a clear statement and analysis from that work that there was underfunding of $530 million of over the last 20 years of Māori organisations. So I just want to repeat that. The Māori organisations that were delivering health and social services were underfunded $530 million over the last 2 decades. And so part of the movement, as Dr. Gill says, to be able to fund right and to commission right is actually to ensure that equitable access to resources is going to be made possible for the Māori Health Authority and the future health system reforms to actually adequately address the inequalities that Māori are experiencing. So that's going to be one of the first things: legislation, funding. What we're seeing at the moment is that the transition unit have been well funded under the Prime Minister's office to look at creating the mechanisms for both Māori Health Authority, the Public Health Unit, and Health New Zealand. These will be the new entities going forward. However, if we think about what Māori have been asking for the Māori Health Authority, we need to have an interdependent relationship directly with the Crown. In the recommendations by Sir Mason, the Māori Health Authority will have a direct relationship with the Minister and not the Ministry of Health. It'll be a direct relationship with the Crown. It will also have strategy to be able to lead and support and influence the other health programs across the other two units. So there is a responsiveness, if you want to call it that, in regards to the accountability by Health New Zealand, which will contain a number of the district health boards, secondary health services, in addition to the public health unit. However, if we think about it, we also need to be thinking about some sort of transfer. There are a number of assets that should be transferred back to iwi. Many of our hospitals sit on our whenua that was gifted by our iwi for the purpose of servicing our community. So there are capital assets that I would be curious about that need to be looked at, probably need to be updated and supported, in addition to a transfer and transition program to Māori. Many of us are fortunate as Māori in different runanga and communities and hapu iwi organisations these days that actually we've got experience whānau. We've got intelligence, we've got know-how. Many of us are pre-settlement, but a lot of us are post-settlement. There are a number of us with some skills, some techniques and some knowledge, and also some knowledge within the hauora space in a very broad sense. If anything with the Māori Health Authority, this is also going to be about supporting Māori communities, Māori whānau hapu iwi, iwi regions and Māori collectives so that they can gain control over their own community health programs, the administration of health resources within those areas, and their own local control and design and evaluation. It may mean then that actually the Māori Health Authority may set the high level strategic goals, but actually it's the communities and our whānau hapu iwi and our hapori Māori who are actually at home is where the real work happens, which is what we're already seeing now across these Māori-led organisations. Now, if we think about, just to give you a bit of a heads up on the kōrero from Sir Mason's conversation, his kōrero is that it will be a new system that is more attuned to Māori and would be better able to deliver the best possible outcomes for Māori. It means that that system will be defined by the norms of Te Ao Māori. It would favour Māori decision-making at all levels. It would foster an integrated approach that would see all Māori organisations working together towards the same goals with the same values. It would bring together all aspects in all areas in health and will continue to consider an approach which brings in education, justice, health, and many other aspects that influence wellbeing. In the new system, there is definitely a preference for commissioning. There will be longer, higher trust relationship and contracts, and there will be the end of short-term contracts. The responsibilities, I guess, in terms of the Māori Health Authority is something that is quite curious if we think about who is designing that right now, who is developing that right now. Even though there's a conversation about iwi partnership boards, actually the leadership, the design development is in the community, and actually we should be seeing the community, whānau hapu iwi, in the transition unit designing the Māori Health Authority. So there's a partai there about who is designing and developing it presently. The other elements, if we think about the new way of working and the runanga whakapiki Māori, which is the concept by Sir Mason, as I said, was presented at Tuitu Haura in 2019, involves a number of close links with wider Māori organisations. It connects all Māori commissioning agencies across all sectors. It takes into account kaupapa Māori education and social services. It includes kaupapa Māori community wellbeing initiatives and trusts, kohanga reo, kura kaupapa, wānanga, and a kaupapa Māori workforce. It also connects all the other national organisations such as Māori Women's Welfare League, iwi chairs, te ora, our nehi Māori, our Māori midwives, our Māori allied health workforces, our kohanga reo true, our ngā whare wānanga. It brings that all in. What we need to do as a collective Māori across Aotearoa is to back this. In order for this to work well, we have to endorse the new system. We have to have strong leadership. We have to advocate and back our own iwi leadership. We need support and backing from the Māori MPs, and we have that, whānau. We've got our first Māori Health Minister, whānau, who also takes the portfolio for whānau ora. These are not coincidental circumstances for us. It is our time for change. So on that note, I'll leave you to pick that up, Huhana. Kia ora koutou.
How the heck can I follow that? Glen, is there anything you want to add as well before we go into Q&A?
I guess what I'm just sort of thinking to myself as a Pākehā, how do I respond to this? And I just think it's pretty fundamentally clear. I mean, yes, there's issues about what shape will it take. There's issues about making sure it's effective. There's issues about who is going to drive the debate, and how is it going to filter out into community and make the changes needed to increase or to create more well-being in our communities. All that stuff, that due diligence needs to be done, and I'm sure that it'll be open to lots of input and clear thinking and politics and all sorts of things. But for me, it always comes back to this as a Pākehā. There is a violence at the heart of our partnership, and that is colonisation. And I see colonisation, like most doctors who have practiced for a while, see their diseases just like their patients. They recognise Mr. Pneumonia, they recognise Mr. Arthritis, they recognise Mr. Viral Infection. There's shapes and āhua that tap them on the shoulder and go, I better have a think about this. And I see Mr. Colonisation most weeks in my office, and where illness, struggle, being separated from the mainstream of society has been handed down generation on generation on generation on generation. To me, it's a real thing. It's not a debatable thing. I see its arms and legs every day. As a Pākehā, yeah, I need to answer to that. And this is one way of answering, saying give back to Māori power, real power. Power that, and actually don't even give it back. Come and take it, Māori. That's part of it, and take what you need to do well. This is an act of health, social, cultural, spiritual health for our country, and it heals Pākehā at the same time as it heals Māori. My sympathies lie with Māori because they've been outside that for too long. But there is an argument, well, it's not even an argument to me. There is a point that this is right in and of itself, because it redresses issues of power and our colonial past, and it forces us to talk to each other, and for Pākehā to play a taina role for, in this situation. Again, why would Māori want to disadvantage anybody in this country? what is good for Māori, in my experience, is nearly 25 years as a doctor, is pretty much good for Pākehā. Most of the ways that I've worked that have been influenced by Māori, you know, most Pākehā want to work that way as well, to be perfectly honest. It's also the way I was trained as a doctor. It's how I was trained to think holistically. It's not exclusive to Māori, that idea of holistic health. It's just that there's an implicit message in our health system not to practice like that. The explicit message is be holistic. The implicit message is don't, because we can't afford it and we haven't got enough time. Yeah. So for me, above all else, it's an act of political, social, cultural health. Once that's dealt with, yes, God is in the detail. Then we get funky and we get it, you know, then we have constructive conversations and sometimes, you know, argy-bargy, we figure it out. But then it becomes the act of two powerful people talking to each other, not a subordinate relationship. Changing that is good in and of itself. Sorry to point, I'm just a doctor, you know, we just point all the time. So does that make sense? That
It does. It does.
I would lob that in there.
Yeah. Thank you. That was awesome. You three have really given a great introduction. We've actually got a heap of questions and we've actually got time to go through them. So I'd like to begin. The first two questions I accidentally answered, so the rest don't see it, but I'll put them out there now. What would you say the keys are to ensuring that the new MHA honours Te Tiriti o Waitangi? And with that is another one which I think goes into it. There was some sort of MHA have some sort of veto. Do you have any details on this and how it will work? So if anyone can answer, well, one or both, that would be fantastic. Thank you. Who would like to start? Maria, thank you.
Kia ora. What would be a measure? One or two measures would be, can we get some feedback from the Y2575 tribunal claimants to give us a bit of a feeling of whether they think that the establishment of the Māori Health Authority currently is on track? And two, I mentioned earlier about a Māori wellbeing legislation. We need our own legislation or constitution that is then utilised for us to be able to ensure the responsibilities. That sounds very kind of complicated and it may be a little bit timely, but I'm kind of curious about where the leadership sits. Certainly this is about an opportunity for a te tiriti relationship and entity being created, Māori directly with the Crown, not with the Crown agencies in between. So I'm kind of curious about the levers that are going to be established in order to support the development of the Māori Health Authority and the new system, and how the other components of the health system will be accountable to ensure they do not continue to breach te tiriti with Māori.
Very good point. I guess just on that, I became aware a few years ago through Te Perenga, which is the collection of hauora services led by Māori. And I discovered that while we are 18% of the population through the census stats, they were receiving a total of 1% of health funding for 18% of the population, which explains why they were underfunded and they're lowly paid. And yet here was this amazing, here was this opportunity for them to provide equity under that one. But however, it doesn't seem to have. So I just thought that was really interesting in how that plays out. It's a difficult one. I'd like to know how it's going to be, how the mechanisms are going to come together and not create that unintended underfunding, separatism, all of those things, but provide a good cohesive relationship so that there's an equity within both systems, that it doesn't take away from one or the other, but gives to all in an equitable way. And that's going to be part of their challenge, isn't it? Mm-hmm. It will be. So Gabriel Swift, so how do whānau from Marae know about being a part of the Māori health reform or even the conversations? Anyone can answer that if you like. Glen, Emily. Or
Yeah,
Glen?
I can just say
I'm
that
I think Emily would be much better off
Yep.
because she knows the pathways in which they
Okay.
can represent themselves. So I think, yeah.
Thank
well,
you.
I can say something, and Maria, I'm hoping you might also have a bit more insight from where my understanding is that, actually, I'll just look at my piece of paper. I was just speaking to somebody today about it. So it's going to be called the Iwi Māori Partnership Boards. So there are going to be Iwi Māori Partnership Boards that are currently being created. So every iwi is obviously made up of hapu marae. So whatever marae you're and might well be connected to multiple, whichever one you try, contact your marae, the trustees who sit on the Māori Trust, contact the chair and ask, how is our iwi creating the Iwi Māori Partnership Board? And find out how your marae, your hapu, can have a conversation, who you can talk to, how those conversations can happen. So that's my understanding of how this process is happening. But Maria, maybe you have some other information on that.
Kia ora. If we think about it in our space at the moment in terms of the hauora and the health space, you can take it that the Māori organisations, the Māori sovereign organisations that are delivering health and social services within regions have got a key leadership role in this, in submissions and conversations and strategies locally. Certainly with the iwi partnership boards, runanga, marae, which are para runanga, and those sort of wider Māori organisations which include iwi, will have representatives according to your region. And I guess just to tautoko Emily's kōrero, you'd be best to contact and have conversations with your own marae representation. But there will be strategies that will be occurring very soon, is my understanding, with a ground-led engagement process about each of the regions in terms of what the iwi partnership boards will look like. Now, for some of the whānau that are actually listening into this kōrero, I guess for those of us that are in the health space, there are already iwi partnership boards that are connected to district health board regions. However, particularly since COVID, with our first rāhui last year, there were a number of stand-up organisations in Māori, particularly, who led out and actually reformed their regions and their approaches. So Te Kaho Taonui is one of those, for example, in Te Tai Tukaro, who, as a whole of Te Tai Tukaro, formed and pulled together a number of their Māori hauora providers and social services, and those groups that had the ability to continue to provide essential services. During all of our struggle to get to understand how to respond to the COVID variant when it first came here in Aotearoa, they also linked really closely with Waikato Tainui, in addition to Kaitahu and many other groups. So there'll be a lot of people within your own community, there'll be somebody connected to your marae, but most importantly, there'll be somebody definitely connected in your leadership with your local hauora provider that will be able to give you some information about how can you, as a resident or civilian or person living in your rohe, or somebody who wants to give back to your own iwi if you're living outside of your rohe, to be able to give a kōrero about how you can support or even understand how you can be part of the new health system and the way going forward.
Thank you for that. Now we have one here. Moana Jackson says that decolonisation as needs to be by Māori, for Māori and of Māori. How can Pākehā be allies when it comes to the creation of the new MHA? That's a good question. And honestly, we do need as allies, because we haven't got enough Māori doctors. We don't have enough Māori nurses. We don't have enough Māori experts. I think there's only one Māori cardiologist who I know quite well through my partner. And that says a lot. We have one Māori clinical psychologist in the country, in the world. They are coming, but they're not quite there yet. But, we're building our skills. But how can Pākehā be allies when it comes to the creation of this? Anyone can answer that?
I think
Yep.
Speaking as one Pākehā, I agree with him, and I think, and it's hard for Pākehā to do this, but I think get out of the way, and trust Māori to figure it out, and I just hope that sometime they will want to come and chat to me about what we do here and how it's informed, how it works with Māori, how it's informed by Māori, that as a Pākehā they will see something of what we do as being of value, but it's not for me to moan or tell them that they have to. They don't. And I think it's really important. You don't give someone their independence, they take it. And I think you get out of the way, and I'm a doctor, man. It's taken me decades. It's still happening, trying to not be paternalistic, and I'm a man. It's like so bred in me. My daughter is kicking it out of me year by year. She kicks it out of me, and my patience. But oh God, it still just rises up if I don't watch. So. Yeah, I hope that Māori will want to come and talk to us, but they don't have to. I think get out of the way and trust and believe, and
handing over some of that power to give balance back. That's fantastic. Thanks for that.
It's hard.
It is hard.
It's also a process of decolonizing. It's bloody hard. And there's everything rises up in me at times, and I have to go away and calm myself down and just, like I say, my daughter is Māori, she's a wahine toa. I get it in the neck if I wander off the path. So she's been really good for that process, but
thank you.
My thing too is I'm always for the bottom-up approach. I've just seen so much health, and even, I said it last week, we design systems, and even a little bit we design from the top. Oh, yep, we'll put these things in the place and it will shape the bottom. I've never seen it happen yet in 25 years. It start at the cellular level, prevent. Don't pay lip service to prevention. Truly put resources into prevention. 2, protect the cellular relationship of primary care, then secondary care. And then you just have somebody pulling, someone who sits at the front and thinks they're leading. But the communities are wise, and they know
community,
are. And sometimes the community is separate even from the iwi, and the iwi has to go back and listen to the community. It's not always about ethnicity, it's about power. And Māori will have to deal with what it is to have power, and does it represent the community? Just the same, these are human issues. But it's time to get out of the way.
Thank you.
I want my daughter to inherit the world.
She will. Dr. Gill.
Yeah, just I couldn't say it better. So the only additional thing is, when you're Pākehā wanting to be an ally, and you're in a setting where it's all Pākehā, that's your other opportunity to be an ally, to say, how come there's only Pākehā voices here? How come we don't have tangata whenua represented here? So that's, for me, the other, yes, it's everything Glen said. And then when you're in the space, notice the missing voices, and you can be the person who says, we're missing a key voice here. A summer student did some interesting research, and so much of our current health system, the decision makers are still predominantly white Pākehā, and strangely not with New Zealand accents. People like me, except for I'm a woman, that's the only difference. But, you know, it's recognizing who's not in the room and being able to say that. So that's the only other comment.
The biggest complaint that will come from Pākehā, in my experience, is that it's separatist. But as I said last week, if you're a young person, if you're a young disabled person living in Southeast Levin, it's already a separate system. You know, this is addressing separate systems. You know, it's addressing that. They don't have representation by anybody. And so that separatism complaint is not thought through, you know.
Thank you for that. So there's another one. Oh, do you want to answer that, Maria? Yes.
Kia ora. Just want to add a different scope to it. Often, and I hope that this isn't viewed in how I've interpreted the recent kōrero, but often we're viewed in a deficit lens as Māori, and so what we really need to be looking at is the cause and the process, and not the challenges. But let's just step it back a little bit, whānau. Māori are not powerless, never have been. You know, if I think about my own hapu, and especially around the hokianga, it was at our marae when they had the tribunal hearings, and the wonderful Rangi Nui Walker, bless his heart, made the really lovely statement about we didn't cede sovereignty. Now, we certainly knew that. But, you know, quite quickly after that, Chris Finlayson, who was the minister at the time, then went to overturn it and say, oh, well, the tribunal's got no mana. So... But let's face it, Māori have never not been powerless, okay? And if you think about it from an economic perspective, we actually are managing a $42 billion asset pool, you know? So we've got some of the largest businesses in New Zealand and in health.
Yes.
So I think we need to be thinking a little bit differently about how we do it. Now, again, if we think about recently and the COVID, the predominant provider of services to Māori and non-Māori and communities, particularly across rural, remote, and even recently in the urban area, thank you very much, whānau water commissioning agencies, is that we've been the first responders to the challenges. In fact, I think one of my colleagues said that some of us are probably a little bit more inclined to be able to respond more effectively in emergencies. We're there in floods. We've been there in terms of the challenges with earthquakes. It's been Māori up front first. So we do need to be thinking about the narrative and the conversation that, darlings, we're not broken. We're not diminished. You know, sometimes it's too easy to focus on the deficit. And Māori are shaping the health system. Many of us are. Yes. And even though we might be small in number in comparison to non-Māori, every single Māori person that is working across the health and social service system are shaping the health system for now and into the future. So kia ora.
Kia ora. That's a powerful statement. Thank you. So from Dougal here, kia ora. How do you see the relationship between the Public Health Agency and the Māori Health Agency, given the intersectorial system-based thinking required to achieve pai ora? How do we ensure that the agency and authority partner most effectively achieve the common goal or pai ora? Who'd like to give that one a go?
Easy. Yep. Focused on wellbeing, not on disease. And in fact, let's face it, if we think about the public health unit, some of the biggest legislation, if we think about alcohol and those sorts of issues, in fact, we need to be thinking about Māori being in the positions to make the decisions around prevention and early intervention and health promotion, those sorts of areas. We need Māori to be leading those spaces. Kia ora.
Kia ora. Thank you for that. We'll move on. We've got quite a few questions, so I'm hoping we can bring them down. What has been the response from the clinical spaces in terms of the introduction of this kaupapa? Is it more positive than negative? In reference to Desmond Darby's comment, I have heard a lot of negative connotations, and could this be more prominent in the urban areas rather than the regional areas, also due to more community connection? What will the change be in working with social services, if any, with the Māori Health Authority? Also, how will they measure the success? This is a long one. How will they measure the success of this introduction to Māori Health Authority, and is there a timeline? Kia ora from the Waikato. So I guess what they're saying is about relationships and the clinical, how they will be. I know, I'll just say briefly, I know that for myself, that I've just been appointed to the clinical governance team, which is basically all full of doctors. And here's me, little old wheelie, going in there. That's a lawyer, not a medical, not a doctor, going in to be a community voice within the clinical team. So that's one way that they've responded. How else do you think they have?
I think Huhana, it's interesting, isn't it? Because I mean, even myself, I was trained as a registered nurse. You too, and I think if we think those of us that select a particular pathway, there'll be some technical, clinical, and other sorts of elements that we've chosen to, to be expert in. And so I think part of it is how do you understand your role in the bigger component? How do you understand in terms of what's your contribution within a whānau ora way of working? What does your service do in terms of being able to support you as a workforce, in addition to be able to be working across integrated kind of systems and things like that? So I think if we're thinking about those types of things, I guess it's also about an opportunity that, as the individual health professional working within a larger team, and then within the larger kind of context, what does that kind of look like, and what are the changes that are going to need to happen for all of us in order to be able to contribute to this new way of working?
Thank you. I have another question here. The disability sector is quite often left behind in all areas of our services. I do hope there is a place for the disability sector within the MHA kaupapa. So do I, Dorothy, so do I. At the moment, we really can't say much about how that's going to be, because we don't know what the disability sector is going to receive until it's announced, and that's Minister Little that will be announcing it. So the one thing I've been very disappointed about is that they've been consulting with 30% of disabled through the DPOs, which exclude Māori, Pacifica, migrant disabled, and pretty much most other disabled. It's just a small group of 7 disabled persons organisations, and unfortunately it's not all of us. And so we've heard nothing, and I've heard nothing, and it seems odd that we're not engaging with those that are involved in DISAC, which is the disability advisories within the DHBs, that's been involved in the disability sectors within the health system. So I don't know if anyone else can really answer that, but I don't believe that we're going to find that out until we know what they're going to pull out for disabled. I don't know. Your thoughts?
I agree, and talk with that. My understanding is that's been one of the major criticisms since this review has come out, is that the disability, even though it was called the Health and Disability Systems Review, that the disability component has not really been dealt with.
I did challenge Heather at the beginning when I was on the welfare group, and she laughed at me and walked off, and noticed that there was no consultation. There was no one on her group. So in other words, we also didn't get mentioned till page 150, but that's a whole other kaupapa. But, there's still work to be done in a nutshell. And I'm hoping that we can start pushing for that level, because, there's a lot of work in the health system that needs to change around that area. That's for sure. So we've still got like 20 open questions. Every time I answer one, another one comes up. So we've only got about 7 minutes. So I'll try and pull out some of the ones that can provide a different angle for answering. Wondering how we might support public discourse by enhancing public understanding and support of Māori ways of seeing health well-being, especially around spiritual aspects. Without understanding can come resistance, which is a very good point. That's a hard one, because I know even with the debates around the end of life choice bill, the cultural component was ignored completely, while well, they brought in the Western view of death and dying, but the cultural views that exist within Aotearoa just weren't there at all. So, I don't know. Any thoughts on that around engaging, informing the public, getting them to understand?
I was wondering if I could tie this in with some other questions that have come up around how can we change clinicians' views, for instance, to a Māori worldview? What are clinicians currently thinking? For me, that question, they sort of tie together. And I think what the person who wrote that question pointed out was that it's often from a place of a lack of knowledge. And I also think that the negative voice often gets a lot of media attention. So it can be in the public discourse, I think it's easy to think that there's a lot of people just focusing on the separatism. And so one fact that I can point out is that when we submitted our petition, the New Zealand Medical Association, which is the pan organization for all doctors in New Zealand, endorsed the petition. And the reason they did that is they canvassed all members. And overwhelmingly, there was a support for a Māori health authority with commissioning rights. So I think that's the main thing I wanted to say, is that changing how people understand things has a lot to do with knowledge. So maybe it's about how we can all talk to each other and within our own social networks. And I know, Anne, you were going to perhaps even speak to that, about what Action Station can do to help us in that public discourse.
We'll do that at 7:50. So Anne will have a good 10 minutes to fill everyone in.
Well, there you go. So that's the lead in. So maybe we'll address those questions at that point.
We can, absolutely, because I think we're going to run out of time in 5 minutes. But there's one for you, Glen. Could Dr. Colquhoun, sorry if I misspelled your name, explain why a person who badly needs a knee and both hips replaced is continually postponed just having a consult meeting with the surgeon? This began October 2020. After 4 postponements since then, latest being today, she's been given another appointment for middle of October. I'm aware of COVID, but here in Palmerston North, very difficult to understand indeed. I guess in part because a lot of the health professionals have actually been diverted to the COVID priorities rather than to what's scheduled around, and there have been a lot of delays, cancer diagnoses, treatments, etc. So I don't know. What are your thoughts, Glen, on that one? Constant delays. Why is this keep happening when even though we've got COVID, how come we're not getting people seen in a timely manner?
Yeah, and I mean, I guess the first thing I'd say is I'm really sorry to hear that. That's horrible and frustrating. And I hang my head as part of that health system. I'm complicit in that. Having said that, we face the same thing with young people getting secondary care too. And I think all primary care doctors, we're always struggling sometimes to get people seen. And we've seen, look, even before COVID, sometimes the waiting times can be, off the chart. And then you add in a pandemic and lockdowns, and it just delays things further and further. And I think it's a sign that the system that's been there is not properly working. And that's a whole webinar or 10 in and of itself, is to know how to rewire the mainstream system of health. I don't think it's good enough. In part, it'll be understaffing. In part, it'll be lack of theatre time at the hospital. It's a question best asked of that DHB, Mid-Central DHB. It's best asked of them. They control those clinics and who is seen and when they're seen. And I imagine, I don't work for them, but I imagine they will say it's a resource issue. I know that that's usually what they get back to us with.
It's a tough one, eh? It's ongoing, and I know because we've experienced postcode discrimination, for instance, being in Counties Manukau but having treatment in the Auckland DHB. So that's been an issue in itself. And I'm wondering if the MHA and the HA are going to get rid of postcode discrimination, make it a lot fairer. It's hard to know what's going to happen until we actually see it in practice. We've got time for one more question. I guess, and sorry everyone, these are all very important, but Anne will be able to answer some of them when she's actually doing her bit, which is around how submissions can be made or any further kōrero and discussions. I guess, yeah, I'll try and find one that hasn't covered it. Will the MHA support integrated healthcare model, valuing as equal alongside mainstream medicine, complementary and alternative healthcare modalities, as well as traditional rongoa Māori? And I note that Rotorua DHB have a rongoa centre within the DHB, which is one way of bringing in that complementary between Western and traditional. Do you think that that would be something that could be integrated under the new authorities?
Kia ora. In fact, Northland District Health Board has gone even further, and they've brought tohunga into the hospitals. It's just a fabulous thing.
Sure.
Tohunga, rongoa, miri, rome, it's beautiful. Kaitaia Hospital is an example. They've got a little whare, which is just at the front of their main entrance, and it's a beautiful spot, and the healers and the tohunga there, but they also, within the actual hospital, have instituted a space for wonderful wahine healers who are delivering rongoa straight there, and it's just fabulous. The opportunity to be able to have a range of methodologies and therapies right there and then, particularly in rural areas, you know, when you come into town to do your business or, you know, to go and see the doctor and that, to actually have rongoa, to have your healers, to have tohunga that not just address perhaps the physical ailments, but also to talk to you around things around wairua. So in fact, these things are happening already, and it's Māori leading these places. So we've got fabulous Māori leadership working in these spots that are making these possible. So yeah, it's happening.
Beautiful, because I've actually been arguing for the re-indigenising of our health system, and that's one example of how it could work. I'm sorry, everybody, we've actually run out of time. It's now Anne's turn to give us some details and final comments. And thank you so much, everyone. And then we'll come back with a karakia and finish. Thank you, Anne.
Thank you, Huhana. So basically what I'm going to do now is, introduce myself maybe. So my name is Anne. I'm the volunteer coordinator at Action Station and also the campaign support person. So before I go into suggesting some of the actions that we can take, I'd like to give you a little bit of context to those actions. So Emily Gill was already referring to it. Ours are more around communication and how we talk to our family and friends and people who might not, you know, be positive towards the Māori Health Authority. So basically how this work started for us at Action Station in late 2017. So Action Station's former director, Laura O'Connell-Rapira, myself and Dr. Emily Beausoleil from Vic Uni, and with input from a range of other people, of course, launched Tau Iwi Tō Toko, which means non-Māori in support of Māori. And this was an experiment to see how, if we could get people to have more caring, more productive, more civilized conversations in online spaces. And we were specifically looking to interact directly with people who were leaving racist comments. And we trained volunteers over the course of 10 weeks, and we did that several times. We trained them in values-based messaging and deep listening techniques. The trainings finished in 2019, but we learned heaps. And from those learnings, we've now come up with a simplified version of the Tau Iwi Tō Toko approach, which is more suited to campaigning, and it aims to influence the public discourse and show solidarity. So the way that it's changed is that now that we talk more to individuals, rather than talking to individuals as we were previously doing, we ask our volunteers to post their own new comments, and they respond to ideas in media articles or to kind of like the collective vibe of a common thread. So what I've done, I've gone ahead and crafted some messages that are based on tested research that people can use, just copy paste into online comms or adapt to talk to your friends and family whenever the topic of the Maori Health Authority comes up. So I'm going to read out those messages, and I'm wondering if Elliot can maybe copy them in the chat as well. But don't worry about, copying and getting them. We'll be sending them out and sharing them later. So yeah, so some examples of a message that you can share would be, Maori should have the final say on what happens to ensure better health outcomes for their whānau, and I stand in solidarity with that. We can only be our best and create a country where everyone can thrive when we listen and acknowledge the truth of our past and present. Together we can work to undo the damage that still causes our Maori whānau to suffer worse health. And that is why I think a Maori Health Authority is worth supporting. When decisions are in our hands, our solutions work and we take care of our communities. We all benefit when we listen to one another and stand in solidarity. So these are ready-made messages that people can use. If you're the kind of person who would like a little bit more guidance and a little bit more insight in how to craft a good message, then next week, Thursday, the 16th of September at lunchtime from 12 to 12:45, I'll be running a tutorial on basically messaging for solidarity. And there's a sign-up form that Elliot will be sharing in the chat as well. So if you don't have to rush to go and fill it out now, but if you click on it, you'll just have it open for after the webinar. And I always say no time like the present. Everyone's fired up, so this is the time to sign up. So if you do come to that tutorial next week, then you'll be invited to join our Action Station Tautoko Facebook group, which is a group that currently has 192 awesome people, and they share resources, they share posts that need love, and we also mobilize from there as Action Station. So at key times in campaigns, we'll then go online together and flood threads with points of view that we want to see more of. So those are the actions that you can take with us. And those are basically, if it'll be a bit quiet now, I think, until we hear more about the Maori Health Authority and until more of the legislation comes into the press. So when those things start to happen, we will need to go in together and yeah, kind of be supportive, because there'll be a lot of people who will be talking about separatism. There will be political football games played with it, and that's when it's useful to kind of reassure people and show support. So in terms of the actions that Dr. Emily Gill mentioned at the very start of the webinar, so you'll probably have forgotten about that, don't stress. Tomorrow you'll get an email from us in which we will just recap all of that. And we also have always a dedicated Tautoko website that gets updated after every webinar, and so everything will also be recapped there in terms of like contacting your GP practice, the marae, or the things that you can do to submit your thoughts into the design. Yeah, so that will come tomorrow. And then, oh yeah, one last thing, big favor. So also in terms of being able to use this webinar and the recording, if anyone is willing and able to step forward and help us with the captioning, that would be great. So you can just email me, ann@actionstation.org.nz. And yeah, so that we can use this video also as it was such a rich kōrero, might as well, send it to the people who make decisions and show them that you care and that we have something to say, so we can use it as a campaigning tool. Yeah, that's really it from me. I will pass the word back to Dr. Hu. Thank you so much for being here tonight.
Kia ora, thank you very much for that. And I just want to say thank you to Action Station for the opportunity, because it's good to, there's so much that goes on. It's very hard sometimes to grasp all the details and the information. And I think tonight it's actually opened the door for others to begin to understand what this new process will be. Even though we're all waiting in anticipation, we're not quite sure how it's going to end up. But in particular, I'd like to thank Maria Baker, Emily Gill and Glen Colquhoun for their wonderful take of how this is going to look, and especially as they all frontline workers. Really, they're the ones that are going to be implementing, and it's so important that we hear how they're going to do this as allies and as Māori doctors as well. We've got to work together on this to make the change. But what's beautiful, it's an opportunity for us to finally see how Māori health can actually run positively. I know I'm hoping, I get frustrated with our health system as much as everyone else, but I'm hoping. I'll close with a karakia and then we'll close off. But just thank you to everyone who attended tonight. I'm sorry I couldn't get all your questions answered. However, as Anne has said, everything is out there for you guys. You can, they'll send you an email, and that'll be an opportunity to take this further to ensure our voices are heard. It is our voices that need to be heard, and you've got that opportunity to do that. So thank you, everybody. Now, mai reo, I'm still learning. I'm not a newbie, but I get it wrong sometimes, but I'm going to try, and it's a closing karakia. So he karakia whakapaki, he kia whakairia te tapu, kia wātea ai te ara, kia turuki whakataha ai, kia turuki whakataha ai, hau mai e hui e tai ki e. Please, everybody, go well, stay well in these times. We've all got to look after each other. At the moment, I'm in the team of 1.5 million, keeping everyone else going here in Tamaki Makaurau. So everyone else out there that's enjoying their takeaways and their whānau visiting, enjoy it, whānau, because, you could be in lockdown yourself one day, who knows? And, just remember us doing it hard over here. Stay well and good night. Ngā mihi.
Kia ora.
Kia ora.
Mā te wā.
Ai.
Kia ora, everyone.
Ka kite. Thank you so much for tonight.
Huhana, we're off to the movies, then a burger,
I've just gone off you right now. You can just go.
Yeah.
Go.